So how does the cannabis work? Now we mentioned again, I told you about the endocannabinoids, which are derived from our brain, the phytocannabinoids, which are from our plants, and then the synthetic. When we talk about the synthetic, marijuana is one that's here in the United States, but there's also a new one that has come out in Europe, Sativex, which is a spray that they're using for patients with MS. And hopefully it will be here and it's going to be in drug studies, but it is also a synthetic form of THC. So the synthetic ones that are here in this country are the Marinol and the Dhanabalan. The problem with this is that the bioavailability, which means that when you take it in, what is really available to you, okay, is only about 10 to 20% when it's taken by mouth. The reason is because it is not very soluble, so it's not able to be mixed so that it can be taken through. It's also metabolized by the liver. And as I mentioned to you, when anything has to go that's taken through the mouth, it goes through metabolization through the liver or the kidneys. When it goes through the liver, again, there's a process. So again, there's damage in that area, and by the time it affects you, it can take from a half an hour to hours later. So it's not something that you say, I'm going to take this right now, as we do with cannabis, and say within 10 to 15 seconds, I will have what I need to impact and make me feel better. And again, the half-life of this is between a half an hour and 60 hours, which means if you took in 10 milligrams, maybe in a half an hour, you might have 5 or 60 hours, which is 3-4 days later, you might have 5 milligrams. So it varies, so there's no consistency with it. And it was prescribed mainly for nausea and vomiting associated with chemotherapy. The side effects were sedation, altered elation, and confusion, which we see, but again, not the same feeling and not the same impact that we have from cannabis. Now, the brain is an amazing part of our body where each part has a function. And again, remember these receptors that we keep talking about. They're in different places, so they're going to impact differently on where they attach. When we talk about the amygdala, there's different portions that we're talking about here. The neurocortex, the amygdala, the hypothalamus, the hippocampus, the brainstem, the cerebellum. Again, different parts function, and this is where the cannabis has different reactions for some people. So when we talk about the amygdala, we can see that it has this portion of emotions, fear, and anxiety. And I'm sure people have told you sometimes people that take THC end up having panic attacks and paranoia. But not everybody experiences that. And some people don't experience it initially, but they can have episodes of it depending on the forms of the cannabis that they use. The basal ganglia, again, movements. So it affects your reaction time of having THC on board. The brainstem, which is the biggest part when people have brain injuries with nausea effects. And this is one of the things I always like to talk about a little bit, is that when we see people with head concussions now, in fact, the NFL is talking about using cannabis because it helps with concussions, because this is one of the things that we're learning. It also, with patients that have had a head trauma, one of their first signs will be nausea, and which is telling the doctor or the clinic, or should be telling them, that something is happening in the brainstem. It's swelling. This is the concern. The cerebellum is for balance. So sometimes people have coordination problems with THC. Memory information. Hypothalamus is for eating, sexual behavior. So again, increased appetite. Neurocortex is for thinking, feeling, and movement. So sometimes people have altered judgment, and sometimes that's a good thing with cannabis. We want them to stop concentrating on their pain or the events that keep bothering them and not being able to function. Motivation and reward, again, feeling good. This is one of the side effects that we have, or the effects that we get. In the spinal cord, we see the pain sensitivity, and this is where the huge part is. People say, I'm in chronic pain. When you use cannabis, it's not that you're not in chronic pain. The pain is not your first important part of your life controlling you. You can cope, which gives you hope. People are on these medications, and you mentioned even just a minute, you're on these narcotics. You're taking them, you can't function, it doesn't improve your quality of life. You're numb maybe at that point. And meanwhile, you've got constipation, the side effects, you can't function, you can't be independent. And these medications not only affect the individual, they affect the families, they affect your co-workers, they affect everything you can do. Now what was interesting is that we started to understand, wow, if this works for this, maybe we should try it for that. And this is what the history that we're learning. People used it in the European times for menstrual cramps. I see a lot of patients now with hepatitis C that use it because of their nausea, their chronic problem, and they don't want the interferon, or they have an interferon. It didn't do anything for them. So they're looking to the other options. HIV, the virus, irritable bowel syndrome. This is something huge that's coming about. It's not just irritable bowel syndrome, but also inflammatory bowel disease, which incorporates Crohn's disease, ulcerative colitis. And this other part, GERD. Does everybody know what GERD is? Gastroesophageal reflux disease, heartburn. If you didn't have it, you're going to have it with most of these medications. And that's another medication that they have to treat you with now. And because they put you on an H2 blocker, the normal acid that you were supposed to have in your stomach is no longer there. So now you need an antibiotic. The antibiotic is going to create a yeast infection. So now you need another pill to put in your vagina or something else. This is just an on and on and on going problem. So my thing is, let's try to nip it in the butt and really treat the underlying problem and not the symptoms. And I'm going to talk a little bit more in detail about the other diseases. Just to mention a few here: epilepsy, seizures, spasticity, cancer, and I'm going to touch upon that as well. So we can see here, what we started to notice was the potential uses for marijuana. Multiple sclerosis, ALS, chronic pain, Tourette's. Tourette's is a syndrome that people want to function, and they function with a tic. They blur out words, they have incoherent actions, but they want to function. So this helps them. HIV patients, hypertension. Now, this is, again, I have patients that are off their blood pressure medications. Blood pressure medications have so many side effects. Sleep apnea is helping for them. GI disorders, incontinence, rheumatic arthritis, skin infections, MRSA. People heard about this? It's called methicillin staph aureus. We used to treat staph infections. Staph is what's on your normal body. Now the medication that works doesn't work anymore. So now we've created another infection from trying to treat an infection. Superviruses, they're still coming out more and more. Osteoporosis. This is huge for the patients. For women and most people in our 30s, mid-30s to 40s, is when we get the most maximum amount of bone density. After that, it's all downhill. Men are protected a little longer because of your hormones and testosterone. Women, if you're heavier, you're getting protected, but who wants to be heavier when we get older? So pruritus is itching of the skin. People with psoriasis, I see patients with eczema that use cannabis topically, and it works. Diabetes. diabetes. We have probably almost 60% of our country is obese. Not even overweight, obese. And we're talking about children now, 10 years old that are diabetic from obesity. Hepatitis C, I mentioned, dystonia, which is muscle spasms, fibromyalgia. At least every one of you know at least one person in this room that has had fibromyalgia, I'm sure. Is there? Most of you, I'm sure, at least knows one person. Alzheimer's, this is growing. We have elderly patients that are living longer with Alzheimer's. And anybody that's had a family member with Alzheimer's, you know how devastating that is. I have Alzheimer's patients that are functional, off their medications. So now we've learned, I've seen it used for patients that are using it for their migraines. It's stopping cancer. It is curing cancer. People are afraid to say this. Cannabis cures cancer. Cannabis can help prevent cancer. Cancer is a cell gone crazy. Stop making them go crazy. It relieves symptoms of chronic diseases. Alzheimer's, glaucoma. This is where it originally really made its big point, because the first patient that got his cannabis used because of glaucoma. Glaucoma leads to blindness. If you're blind, you can't do a whole lot of being independent. You'll still need assistance. And here we are not only preventing it, we're keeping the glaucoma down to where they don't have glaucoma. Again, we are curing glaucoma in patients. This is maybe not across the board for everybody, but it is doing it for patients. We have seen how it works. Cannabis cures hepatitis. Hepatitis, any itis that you hear, arthritis, osteoitis, bursitis. Itis just means inflammation of. Okay, so hepatitis is inflammation of the liver cells. And again, hepatitis was acquired in multiple ways. People get it from sexual contact, blood transfusions. People don't know how they got it. People got it when it was not just that they were using IV drug abuse, but people had gotten blood transfusions. And back then they didn't check all the blood. Years later, patients come in with non-specific symptoms where they're having nausea, muscle aches, fatigue, and not knowing, show up in the doctor's office, and finally somebody checks them. Because they're saying, well, I never used IV drugs. I never had this. And they've had some exposure, and there is really, on the outside world right now in the United States, there's no treatment for hepatitis C, other than some of these interferons and other things that they're trying in keeping their viral load low. Cannabis prevents diabetes. So if you prevent it, you don't get the disease. If you don't get the disease, you don't get the complications. If you don't get the complications, you don't cost healthcare dollars. So this is not just point A, but it's going to impact this whole Obamacare, I think, as well. I see a lot of diabetic patients that, will say I'm diabetic, but then they have the peripheral neuropathy, the pain that they are unable to control, and there's nothing that they can do. And diabetes right now is not a medical criteria in all states, but the symptoms of the illness are. Now this is huge to show that how one drug impacts the system again, the whole system to work together. It affects from the brain, from your digestive system, to the fat in your body. And the fat in your body controls so many things, whether you need energy or to store energy. It varies. And this is where cannabis is going to be used, and is used, not just for people to increase their appetite, but also to decrease their appetite. So it's not just everybody that uses cannabis has got the munchies. So that it helps in so many other ways as well. It affects the liver that needs to heal. It affects your muscles, so people are able to move. It affects every part of your system. When we talk about cannabinoids, we learn that the cannabis has something like over 60 to 80 different cannabinoids. We have still learning more and more. Okay? This chart here kind of concentrates more on the non-psychotropic cannabinoids. So the CBDs, the big ones that we talk about. And there's lots of different charts out there. Try to get familiar with these. Educate yourself on the products you're using and see how it works for you. So then you can educate some other people. And you can see here as well, even though we've got the CBDs, oops, I'm going to go to this chart because it's a little brighter and I can see better. The CBDs here, huge aspect. Antibacterial, cancer cell growth, inhibits it. Neuroprotective, promotes bone growth, reduces seizures and convulsions. And this is why it's made its name here in Georgia with younger children as well. It reduces blood sugar level. This is how it's helping with diabetes. It helps our immune system. If you're able to fight off not getting sick, you don't have a complication. And that's huge for people that already have an immune problem. If you're diabetic and you catch a cold, or if you have COPD and you catch a cold, your immune system is not able to fight it off. But cannabis helps in that. Reduces inflammation. Artery blockage. It's a vasodilator. It's helping people that have heart attacks. It helps people that have strokes. It helps people with bowel issues, small bowel, contractures, people that have had surgeries, people that have been toxified by their medications from the side effects. It relieves pain, anxiety. It also helps muscle spasms, helps you calm down, treats psoriasis, and it's a vasodilaxant, so opens things up, gets blood flowing. If you look at some of the other ones, again, there's the CBGs, aids in sleep, CBGAs, again, inflammation. You can see there's a lot of overlap. And this is why I have a concern with these legislative bills that are only going out for one segment. They're not understanding this whole process. They need to understand, it's not just one piece. You can have multiple impacts of it. And I still don't understand why they are so scared of THC. Don't get it yet. But we're going to work on it. All right, so as far as cannabis, you can take it in three primary ways. You can ingest it, but remember with ingestion, it varies from person to person. You don't know the contents of the product that you're consuming. You don't know if the product is made the same way each time. And you don't know what went into the initial product. So that can vary in time. But they're also having sodas, people are drinking, people are making teas. So there's different variations and combinations. And when I talk to my patients and I counsel them, I'll say to them, there is no one cookie cutter for everybody. What works for Joe might not work for Mary, what works for Mary doesn't work for Tim, or what works for Tim only in the daytime works for Mary at nighttime. It's just a combination. And so what I tell my patients to do is to journal. And I'll tell them, give yourself a journal, give yourself a scale of 0 to 5, give your top 3 symptoms, if it's sleep, if it's joint mobility, if it's just having a quality of life that you feel good that day. Give yourself a scale. and see which combinations work best for you. So smoked cannabis is either we are now using the vape pens, you're either taking it through a pipe, through a bong, through a joint, and also the two things in between the smoking and the vaporization is just less irritant. But that whole thing needs to be befundled, because a lot of misconception there that smoking will create lung cancer. Well, the data proves absolutely the opposite. If you look at the general population, people that don't smoke at all and people that smoke cannabis have less cancers. Go figure. And we just talked about that it's preventive against cancer. When they look at tobacco smokers that use cannabis, it's the tobacco smoke, the tobacco tar that's creating the cancers. When you had cannabis, people that used only cannabis, you did not see the cancers. And as much as people say that, you know, smoking, I always put that in because I need to, as a clinician, that it's an irritant. Anything that becomes an irritant has a potential of becoming carcinogenic on that note as well. When people consume the smoking, though, it's a quick delivery system. It's not that they're waiting around to say, am I going to feel better? They're able to take 2 hits, 3 hits, whatever it may be, and within 15 seconds, 20 seconds, they get their impact. So they're not waiting, and it also works well for them. As far as, this is the range of where it is very interesting. When somebody will say to me, the first time I used it, I had no impact. And this is where the receptors have to get evoked. Okay? It's like seeing something for the first time, you might not recognize it. But after a while, even the smell of that object is going to make you know what that object is. The same way the body needs time to recognize it. And the first time, sometimes only 10% of the people actually get the impact. But heavy users get about 25%. So the toxicology of this whole beautiful product is that it's not toxic. It has a wide therapeutic range, and there is no direct deaths from cannabis. And I'm going to reiterate that again later. The fatal dose is unknown. There's been some animal studies that show that maybe 4,000 to 40 times the highest recreation, you would be sleeping. And that's the other thing about cannabis. Alcohol, narcotics, opiates kill you through the respiratory system. They depress your respiratory system. Cannabis does not. Cannabis does not depress the respiratory system, and that is why nobody dies from a cannabis overdose. There's been some implications that it's involved with underlying heart disease and arrhythmias and heart attack. None of this is confirmed, and in fact, it's going the other way. This is a great cheat sheet. Has any of you seen these? How many of you have seen this one? It's great, and this is where I want you guys to get information. I want first for you guys to start with you being educated. Once you're educated, you can talk about it and teach it to other people. But this, I like this sheet, and blow it up a little bit here. And you can see that I'm very color coordinated. And I like to see things and see what is easy to understand. So you can see how one protects against cancer. And this again, if you look down here, you can see that there's more than one type. There's so many different forms that affect anti-inflammatory. So this is where we're saying that we still don't know where all the receptors are. This is why when cannabis is taken as a whole product, it works. You don't have to say pick and choose these things separately out of it. But this is out there, and if you guys have any questions, I am available at the to talk. There's some amazing researchers that are out there doing work, and I really want to be like the people when you see their names, Dr. McAllister, Dr. Herman Planner, Dr. Manelli, Dr. Guzman, Dr. Abram, Dr. Berman. These are all people that have been preaching, have been trying to put the research out there. We're learning a lot about schizophrenia and cannabis. And what's interesting about this is that a lot of people in the beginning were saying cannabis made me crazy. We're finding out it's just the other way around. Cannabis keeps you sane. And this is just a picture that shows the orange lit up areas where in a schizophrenic patient it's much more lit up. And after the consumption of cannabis, it's much more lower. And this came out from a Brazilian study, okay? And for years, the faculty argued that there was no reason for cannabis, but that's changing. This is changing everywhere. People are saying there is a cause and we need to do this. And the other study that was determined and it counted psychosis as well in 2004. A study published last year found that cannabis CBD can improve cognitive function. I have dementia patients that are able to cope and have hope because their symptoms are controlled. A group of Brazilian researchers, Rafael, Quinn, and Fernando, they published in Frontiers investigating the different sorts of treatment that they're going to be looking at for cannabis and cannabinoids. So it's happening. It's going to take time. So this is the main properties of cannabis. If there's 4 properties that you want to understand why it works, it's anti-proliferative against, so it protects cancer cells from reproducing. At the same time, it does not impact the healthy cells. Where we take antibiotics or agents, they don't just say, well, you got this bacteria, I'm only going after that. They just go, that's why broad-spectrum antibiotics kill everything in the gut, and you have to replenish your gut bacteria. Versus, this is working specifically on the cancer cells. It's anti-angiogenic. You need blood supply for something to grow. This specifically goes and cuts off the blood supply for the cancer cells, thereby killing the cancer cell. It's anti-metastatic. You've all heard the word, they've got metastasis to the bone. They've had metastasis to their brain. Metastasis means spreading to another organ. Cannabis helps with that. It's apoptotic, which means induces the cancer cells to seek their own death. What that means is when a cell has lived its life, it's time to be put to sleep. And it knows to put those cells to sleep. And that's another beauty of it. Cannabis has helped in treating melanoma. So I've talked to you a little bit about the brain, which is inside of you, to something as superficial as what's on the outside of you. Melanoma is a skin cancer that's out there. And everybody, I tell them, please check your skin. Remember your ABCDs with melanoma. A, any mole that you see on your body that's asymmetrical. If you cut it down the middle, if it's unequal. B, if the borders of it are irregular. C, if there's a color change. There's different pigments within that lesion. And D, the diameter starts to grow. Okay? So here we see somebody that's treated with cannabis oils for melanoma.